Uh,
What are you doing tomorrow?
so we are recording. All right, welcome everyone to the Gilead Compass Initiative webinar on writing abstracts to respond to the Gilead Compass call for abstracts in partnership with the Journal for Healthcare for the Poor and Underserved. An exciting new opportunity that we are embarking on together. So welcome, welcome. Appreciate your interest. So before we start, just to talk a little bit about who is in the room. I see some familiar names, some familiar faces. It's great to see everyone. My name is Megan Stanton. I am the Director of Evaluation at the University of Houston Sustain Compass Coordinating Center. This webinar, well, I'll kick it off, and then I will be joined by my colleagues, Nina Smith-Bankhead, who is the administrative lead of the Emory Compass Coordinating Center, and Allison Matthews, the Center Director for the Wake Forest School of Divinity Compass Faith Coordinating Center. We are also joined today by Dr. Virginia Brennan, the editor of the Journal of Healthcare for the Poor and Underserved. So big thanks to her for coming on and being available for any questions. And also thanks to Kia Colbert, who is present and organized this webinar from the Emory Center, and the Compass Publication and Dissemination Committee, of which the three of us are a part, or four of us, but the entire committee was tasked with putting together this call for abstracts. And thanks to you for taking some time somewhere around your lunch hour, probably, to join us today. So our goals for the webinar today. First, we are going to go over the basics. I know there's probably a range of experience and exposure to academic journals, publishing in academic journals. And so we'll cover briefly the context. So what is this thing that you're responding to, right? What is a journal supplemental issue? A little bit about why you may want to answer this call, who specifically is eligible, and the nuts and bolts of the timeline and process. So all of this is outlined in the call for abstracts, but it's a lot of information. And so we're just going to go through that clearly and slowly at the first part of this webinar. Then I'm going to turn it over to Nina, who's going to talk a little bit about how to brainstorm ideas to respond to this call. So at this early stage, how can we just get jump started? What are the kinds of topics that we're interested in soliciting or engaging with in this call for abstracts? It's a wide range of topics. And so Nina will talk a bit about that to get your sparks flying. And then I'll turn it over to Dr. Matthews to really get into the weeds about the different types of papers that are appropriate for this call, and then some tips on how to write an effective abstract for a call for papers. And so we'll get into that. The whole thing is recorded and will be accessible. So if you have colleagues or you want to be able to refer back to the webinar, that will be available to you all. Great, so let's dive in. So first, and very basically, what is an academic journal supplemental issue? Some of you may be familiar with this platform for publishing, and others may not. Broadly, an academic journal is different than other types of publishing opportunities, right? So at its very core, an academic journal is an edited publication designed to share research findings, ideas, sometimes protocols, commentaries on pressing issues, as well as lessons learned in various fields. And there's academic journals for all kinds of fields. I'm sure you've drawn on academic journal articles to write grants or research evidence-based practices. But a key aspect of an academic journal compared to other types of publications is that papers submitted to academic journals are then put through a process called peer review. And that is really foundational to sort of the scientific process and the peer review process. So the peer review process means that you write a manuscript, you write an article, and then you, through a journal, that article gets sent to other experts in the field to review, to give feedback, to critique, and ultimately to decide whether or not that specific article is both a fit for the journal, has the sort of level of rigor or integrity that's expected of the journal. And then if they decide to proceed, you can then be published through that journal. So that peer review piece really sets an academic
Look
journal
forward to getting your concrete done.
apart from other platforms. Now, academic journals are usually published in volumes in a sort of cyclical and regular manner, right? They have broad topics, and a range of articles get published in this periodic way. A supplemental issue is a little bit different. It kind of stands outside of that regular publishing schedule and is devoted to a specific topic or theme. And importantly, is sponsored by an entity outside of the journal. So in this case, this supplemental issue that we're partnering on with the Journal for the Healthcare of the Poor and Underserved is sponsored by the Gilead Compass Initiative and will therefore be entirely committed to articles about the impact and the process of the Compass Initiative. And then the last piece I want to highlight, just for some context, is that this supplemental issue will be made open access. This is a really important element of accessibility, of public impact, that is going to be unique about this supplemental issue in many ways. So traditionally, access to academic journals require a subscription, and this usually happens through an institution. And so often to access academic journals, you need some sort of affiliation with, for example, a university. If you don't have access to an institution that has a subscription, you need to purchase journal articles to use them, right? Because publication has associated costs. What's unique about an open access issue is that the articles in an open access journal will be freely accessible for the public to access, search for, download, read without those associated costs. And so we're happy to say that this supplemental issue on the Gilead Compass Initiative will be open access. So I hope that helps clarify some of these terms, right, which might be a bit unfamiliar. So this entire thing is made possible with this really exciting partnership with the Journal of Healthcare for the Poor and Underserved. So JHCPU is a peer-reviewed journal focusing on contemporary healthcare issues of medically underserved communities. So it publishes articles coming from a range of geographic regions, and it was founded by the then president of Meharry Medical College and has been a part of this long-standing proud history, particularly around Black healthcare civil rights and that movement. It's still owned and edited by Meharry Medical College. It's in its 33rd continuous volume, and it's published by Johns Hopkins University Press. And so really a great partnership with parallel goals and values as the Gilead Compass Initiative. So before we get into the how, I think it's always valuable to talk a little bit about the why. So why publish in an academic journal? Academic venues can be intimidating, even for me, and I am an academic. And so why embark on this process? So, one thing that we really thought about with the Publication and Dissemination Committee is just the incredible wealth of knowledge that you all have, right? We work with you as Compass partners, and we know that you all are at the cutting edge of community-based, innovative, inventive and effective programs, approaches, interventions, and practices. And so you have valuable knowledge to share, and this is an opportunity to share that and influence how a broader audience can better and more effectively engage in policies, programs, and interventions to address HIV in the Southern US. Right, and in that, sharing your practices, methods, and strategies can contribute to the body of knowledge, right? This is what we think about in terms of public impact of your work. Can you contribute what you've learned to help influence others who are seeking guidance on how to do work? Secondly, you are an expert. We know that, and publishing in a journal is a way to continue to establish yourself and your organization as a subject matter expert in your field, because a wider audience will be exposed to the work that you do. And then finally, it's also an opportunity to raise the visibility of the organization and the work that y'all do. So publishing can raise your profile among potential funders. It is a very exciting experience to be proposing something and to be able to cite yourself and your own work to build credibility for your work. And also know that this issue, as I said earlier, because it's public access, will be accessible and also widely shared. We're really excited about sharing this sort of legacy document of the Compass initiative widely. And so you can be a part of that. Okay, so we're going to get deep into the details later on and throughout this webinar, but we just wanted to highlight first off the basics, right? At the end of the day, what are the documents you are going to need to respond to this call for abstracts? And so brass tacks is that you will need a cover letter, which is fairly simple and uniform, and Dr. Matthews will review that, and an abstract, right? And an abstract is a brief summary of the main points of what your paper would eventually be, right? And again, we're going to go in depth. To just establish the overarching goal of this supplemental issue, it is to highlight the impact, lessons learned, community-based programs and interventions supported by the Gilead Compass Initiative. So it is Gilead Compass specific. So to that end, eligibility to contribute to this call for abstracts, you have to be a Compass partner, a coordinating center, the Southern HIV Impact Fund, GLAD, ETR, our external evaluators, and funded partners and colleagues are all welcome to submit abstracts to this supplemental issue, right? Because we are seeking to share stories and our research articles about the work supported by the Gilead Compass Initiative, the abstract does have to be only open to Compass partners, and the abstracts are related to the impact of Compass work. So not more broadly HIV in the South, not more broadly, community-based approaches to addressing HIV, but really specific to the work of the Gilead Compass Initiative. So looking at the full timeline, I know most people just have this July 22nd date in their heads, and that's good. That's the first thing to think about. But to look at the whole process, abstracts are due July 22nd at 11:59 Pacific Standard Time. I'll review that date again. But then the process from there unfolds as follows. The abstracts that are submitted will be reviewed by a committee for their appropriateness to the call and for the quality and relevance of the ideas. Then in mid-August, abstract notifications will be sent to those who have submitted an abstract, and 50 abstracts will be selected to submit a full paper for review. Right, so 50 abstracts will be selected for a full paper. Those full papers, fully written out manuscripts, will be due October 1st. Of those 50 papers that are submitted, 20 papers will be selected for publication in the supplemental issue. All right, so we recognize that means 30 fully written papers will not be selected for publication in this supplemental issue. And so the Publication and Dissemination Committee is working on other opportunities to share those fully written articles. We know a lot of work goes into fleshing out an abstract into a fully written article, and we really want to celebrate as much work that you all and we all are doing as possible. So we will find other opportunities for sharing, but only 20 will be selected to be in the supplemental issue itself, published by the Journal for the Healthcare Poor and Underserved. Then we'll move into that review process in fall and early fall of 2022 and early 2023 to refine those papers, to have feedback. And then the actual issue will be released in conjunction with Southern HIV/AIDS Awareness Day in 2023. So that is tip to tail, the full process. But again, the most pressing date to remember is, July 22nd, 11:59 Pacific Standard Time. And the process for submitting abstracts and cover letters is just emailing it to this email address. All right, so a brief overview of the sort of regulations of the abstract is that abstracts must be in English. They're up to 250 words in length. So these are brief, brief abstracts. They can have multiple authors, but there is a limit of 10 co-authors on an abstract. And again, Dr. Matthews will go much more detail, but an abstract is really just a summary of the project and the paper that includes the purpose, a brief description, methods, if that's applicable to what you're doing, outcomes associated with the project, and the impact or implication of the project for future work. These abstracts should have enough detail and enough specificity to them that reviewers can evaluate the proposed paper in a fully informed way. So make sure every anticipated part of the paper is reflected briefly in the abstract. All right, and then finally, for my part, the Journal for the Healthcare of the Poor and Underserved accepts a range of different types of papers. And so you can see there's reports from the field, original research, brief communications, commentaries, and then heroes and great ideas columns. All of these are welcome to be submitted in this call for abstracts. Original research and brief communications are those types of papers that are research-based, right? So those are papers where you had a research question, you systematically collected data, analyzed that data, and have sort of results and conclusions from that data. So these are data-driven papers. You are extremely welcome if you have engaged in a research process to submit original research and brief communication papers. We also know that not everyone is engaged in research in that way. And so in this webinar particularly, we're going to highlight reports from the field, which are more descriptive and programmatic, commentaries addressing essential issues, and heroes and great ideas columns. And with that, I will turn it over to Nina to talk about brainstorming ideas for an abstract.
Good afternoon, everyone. Again, my name is Nina Smith-Bankhead, for those of you who I don't know. And we're going to spend a few minutes thinking about and talking about ways to start to get your juices flowing, and some ideas that you may want to consider to get you started with your abstract. Next slide, please. Next, thank you. So some ways that you may want to start to brainstorm ideas are to start with some of the best practices from existing work or current work that you do. So what have you done that has made an impact on the community? Maybe some of that information is in annual reports or in some of your evaluation reports, or maybe you've already published something, as Megan mentioned. But what are some best practices or some unique ideas that you've identified in the work that you do that really have an impact in community? Does your organization have any unique approaches or creative practices that should be highlighted? So is there anything that you do differently than what's been done before? So have you adapted any existing interventions or any existing practices that have had some success and successful outcomes? Again, as I mentioned before, in your organizational annual reports, they may help to generate some ideas for you. your evaluation reports, especially if you got feedback from your evaluation reports that said this is something you may want to look into more. These are some things you might want to revisit. So has that happened anywhere in your previous work? You also want to consider programs or topics that you may have presented at past conferences. So if you submitted an abstract for a conference, or you submitted a topic or a discussion that you wanted to bring to a conference, this may be an opportunity to expand on that and submit an article about it for this paper. Have you been asked to present on a specific thing at an annual meeting or meeting of other people in the field? Again, something that you can consider. And then, has your organization already been featured in a newspaper or a magazine for the work that you've done? Compass has highlighted a number of your accomplishments throughout the 4.5 years of the project. And so if you've written a blog or an editorial, maybe a white paper, again, if you've been featured for any of your community-based work, all of these are great ways to sort of think about how to get started with your abstract. Next slide, please. So we also, the P&D committee really wanted to help out and help think through some ideas or topics that you may want to consider, not just places to go to think about generating topics, but what are some specific topics that we've recognized that some of you may be interested in? So again, program evaluation, lessons learned, or best practices are something to consider. The intersections of mental health and HIV, or substance use, harm reduction in HIV, or even faith in HIV, any innovative practices there. Capacity building to help your organization become sustainable. Any best practices there that you've identified. Addressing HIV stigma, of course. Any unique practices around policy and movement building. I know a number of you are engaged in that work. Collaborations or partnerships that have helped to advance health and justice. And again, a number of you have worked on collaborative projects with other organizations and other partners. And so there may be some practices in there that you want to consider. Finally, on this slide, we want to talk, you might have some best practices in language justice, specifically around accessibility and multilingual communication. So again, some things to start thinking about. Hopefully, so far we've generated some thoughts for you, or some concepts that you may want to expand on. Also, the innovative use of technology and interventions, adapting interventions, as I mentioned before, integrating harm reduction practices into your organizational structure, as well as trauma-informed care practices. Some of you are working on reproductive wellness in HIV, so there's a variety of topics. And again, these may be things that you've worked on as a Compass grantee. HIV advocacy, or SHIFT grantee, I apologize. HIV advocacy, and then addressing the digital insecurity of the South. There have been a lot of conversations lately, and we've actually worked with a number of our partners to talk about the need for enhanced digital access. And so there may be some ideas there that would be interesting as a publication. And then finally, developing and implementing HIV campaigns or any communication strategies, social justice, and really thinking about social justice, especially as it's integrated in and included in grant making. A number of the coordinating centers and SHIFT have actually engaged in some of those conversations. Some of you have really implemented some unique telehealth or telemedicine processes, especially as a result of COVID. Meaningful involvement of people living with HIV and MIPA, and how that shows up in the work that you do or in our communities. Again, so many adaptations happen around COVID. So how did we adapt to COVID-19, and what kind of practices did we put in place? We've had some webinars, and some of you were actually speakers on those webinars. So maybe there's something in that you may want to highlight. Many of you have been beneficiaries of small grants as well as some of the larger funding opportunities. And then those of us who have administered those. Any ideas or thoughts around leveraging small grants to help gain larger grants and opportunities to advance HIV care and prevention services? And then finally, digital strategies that have been used to combat stigma. So there are a lot of different things that you can consider in your existing work, existing reports, existing documents that may be able to help spark some ideas. Now, I know many of you already have ideas, you're ready to hit the ground running, but we wanted to just take a minute to help you think through some of those. Just wanted to remind everyone that we will have another webinar, and the dates, I believe those dates are toward the end, but we will have another webinar that will be more of a TA opportunity or an opportunity to discuss in greater detail ways to get some ideas going. And so we'll make sure those dates are available to you as well. And so next, I will pass it on to Allison, who again will go into the weeds about the journal call and more specifically the different types of abstracts you may be interested in submitting.
All right, hello everyone. Okay, so the weeds. Yes, so with applying for the abstract, like we mentioned, there are two documents that you'll need. You'll need your cover letter and your abstract. What is included in a cover letter for a journal is different than what you might do for a job application. So for a cover letter for a journal, for an abstract, or for an article, you would want to include the names, degrees, and community leadership roles and affiliations of the authors, as well as any information that you think is important for the editors. So the type of information that we're talking about, you can go to the next slide, because we have an example of a cover letter that I wrote for a manuscript that I published a few years ago. So this one, you title it to the editor, who is Virginia Brennan, and then you include the title of the manuscript, and then saying that you would like to submit it for publication, and giving one or two sentences on what the article is about. Very, very brief. So this one is highlighting crowdsourcing as community engagement to promote uptake of HIV self-testing kits among African Americans in the South. So that gives the editor an idea of like what the article is about really quickly, to see, okay, what category does it fit in? What topic does it cover? And what's the method? Because the crowdsourcing for us, crowdsourcing as community engagement is the method. The goal or the result was promoting uptake of HIV self-testing kits. The group of people it was engaging was African Americans, and the location was in the South. So that kind of gives them an idea. Important, Virginia says, people should say the abstract is for the Compass Initiative in the cover letter. Thank you for that. And then also kind of articulating how the abstract is fulfilling a gap in our knowledge. So we're saying we think, and why it's connected to, why it would be a good fit for the journal. So I did a little bit of research on what types of articles the journal publishes. I think for this supplemental issue, you can maybe say it in that way. It's a good fit for the supplemental issue because it covers these topics that are highlighted as important for us to cover for this supplemental issue. And then it cannot be published, like the entire manuscript as a whole cannot have been previously published elsewhere. So it has to be original work, even if, like Nina was saying, that you're pulling from your previous grants that you wrote, or from articles that were published or reports that were published. You can pull from that. You can use them as ideas. You can use it as a foundation for your paper, but the entire manuscript has to be original and not published anywhere else. So what's unique about the cover letter for the abstract is that you would also include all of the names and titles and affiliations of the authors. So different from this cover letter where I just have my name and my address and affiliation. If you go to the next slide, I believe. Go back. In here, you'll see we have the author's names, and then I have some superscript that gives the numbers for the types of affiliation. So if you notice on mine, I at that time was affiliated with two, yes, we will be sharing these slides. I was affiliated with two different institutions at UNC Chapel Hill. So I listed both. I was in the Department of Social Medicine as well as in the Institute for Global Health and Infectious Disease. So I just used 1 and 2 and then put it after my name. So if you're a community person or community organization, you would put your organization there, like Compassionate Atlanta. Or if you're not affiliated, or if an author that is helping with your abstract and or manuscript is not affiliated with any organization, then they can title it community partner, and that would be their affiliation, and maybe put the city where they're in, community partner, comma, Chapel Hill, North Carolina. And then the corresponding author is usually the first author. So the first author is the one who, like, the reason why we put this here is, one, for the journal to be able to know who to contact, but also when you get published, if people read your article and they have questions, they will contact that first author, and they want to be able to have the contact information to be able to email and or call that person to ask questions. Next slide. All right, tips for writing an abstract. So like we said, abstracts are short, they're 250 words. That actually can be kind of hard to summarize everything in 250 words, but I think as all of you have applied for and gotten funding from us, you're very familiar with that process of limiting your words and creating summaries. So to write an abstract, the authors must have a clear idea of the outline of their paper, even if the paper is not written yet. It's 250 words. That was a typo. It should not be 350. The type of paper is important. Decide whether you're going to write a reports from the field, a commentary, brief communication. So you have to decide ahead of time what type of paper you're going to submit, so then that can help organize your outline for your abstract. And the call that we sent out should have kind of an outline of the ground rules, the topics considered, the word limit, and all of that. Yeah, it should be 250 words, not 350. Okay, so a lot of these tips are coming from this website, inago.com. And so we included the link in there. So the purpose of the abstract is to summarize the main points of your paper. You need to convince the organizers that you have something valuable to add. It should be focused and clear, explain your topic and main points. Next point, next slide. So, like we mentioned, making sure that it fits well with the group of Gilead Compass papers. You want to avoid, so especially with the abstract, minimizing the number of like filler words, very relatively fundamentally, basically you don't even really need, for example, it can be very, very concise language because it's only 250 words. Keep them short and crisp, and make sure that you have other people review the abstracts and give you edits. Usually what I do is I just start the abstract without thinking about the limit, and so that I get out everything that I need. And And then I go in and start to just kind of cut away at it and get other people to look at it and cut away at it as well. So the main point of your abstract is to catch attention, to really to articulate what's new about what you're writing, what's new about your project, how does it fill a knowledge gap, and then what did you do, like how did you do it, and then what was the impact. So that, I think if you just break it down in that way, that can help you think about what to include in the abstract. Next slide. Okay, so reports from the field type papers are descriptives. They're 2,000 words for the full manuscript. We're talking about right now just the abstract, but this gives you an idea if you choose to write an abstract for a reports from the field paper, the full paper would be 2,000 words. And I think 2,000 words is probably 4 or 5 pages max. These papers double spaced. These papers may be about different topics that we believe are.
Could I just say it's 10 pages double spaced?
Oh, thank you. Okay, 10 pages. I was thinking 500 words per page, but yeah, okay, 10 pages double spaced. So programs, interventions, innovative practices, understudied values in public health, efforts to use prior research findings to craft policy and or practice. So Virginia, do you have any other kind of thoughts on what a reports from the field type paper would look like?
Mainly this, that however you want to talk about your program or your work, that it should be an engaging and really generally accessible description of that work. So the engagement is really important because it isn't a very formal paper, so people can't evaluate it on formal characteristics. It's going to be about how well you're kind of conveying something new to people and making them sit up and take notice. So it can be a very wide range of topics. And so don't parse too carefully the general categories here. Let yourself express what your particular work is about in this category. That's what this category is for. So it's kind of wide open within the word limits.
So engaging, meaning that perhaps you would talk about how the project got started, who were the people who were involved, what worked really well, maybe getting some quotes from people who were part of the project that you, or like maybe some participants in the project or people who benefited from your intervention or from your project. Is that a good kind of?
And I would even begin even more at the basic level and say, here are the reasons the work we do is necessary. You know, unfortunately, it's necessary for us to do this because X, Y, and Z is the situation that we're confronted with, and we're trying to overcome that situation. So making it clear right up front what the problem is an important part of engaging the reader. And then talking about the work that you do in a way that emphasizes what's new and important about the take that you've or the way that you've engaged with the problem that you just identified.
Yes, thank you. I'm going to keep asking you questions as I go through this.
All
right, next slide. Okay, so abstracts for reports from the field. A title matters, make sure it's catchy and accurate, but I think kind of short. Usually titles, you don't want them to be longer than 10 words. Start with a clear statement about why the work you are reporting on matters. Provide, and that goes back to Virginia's point about like what's the problem? You know, maybe it's HIV prevalence among Black Americans aged 18 to 30 in Atlanta is disproportionately impacted, but especially among Black men who have sex with men. And there's very little interventions that focus on using plays to engage that group, using the arts and plays to engage that group. And so we're reporting on how the plays had an impact and helped with storytelling and in engaging people in critical dialogue.
That's perfect.
Yeah. And then provide some idea of the time frame for the program. So how long, when did it start? When did it end? How long did people participate in it? Is it still active? Is it ongoing, or has it ended? Describe the setting. Describe the hello. Can you all hear me? Okay, I don't know why I got some error messages. Okay, describe the setting in which your work occurs. So saying it's in Atlanta, with the types of people that you are engaging. So Black MSM, men who have sex with men, and the staff. You don't necessarily need to list out the names of the staff who are involved, but you could say that it's the name of the organization and the types of staff that are involved. So like project manager, faith leader, that kind of thing. You don't need to list out the people's specific names. And then describe the work itself, as many details as possible. So, and think about this as a way of like describing to someone, if someone were to read this article and then figure out how to want to go replicate it. And so you want to be detailed in the step-by-step process on how you implemented it and how do you know that it was effective. So the way that you can demonstrate effectiveness is maybe you had some surveys, maybe you got some feedback from people after the fact. Maybe you could include the number of people who attended the play. Maybe you got some quotes from people who participated in the play or who attended the play. So that's kind of the evidence or the way that you can evaluate and show in a short, quick, concise way, a report from the field. Okay, next slide. Commentaries are essays on timely issues related to and the healthcare of underserved populations. They're structured as arguments leading to conclusions. So this is maybe a pressing issue that your project, this is all related to Compass though. So if something that you were funded for. So I'm thinking about Sandy Bailey, one project, like I know, or like with us, with the faith-based work that we do, we work with faith leaders to train them on how to talk about HIV in faith communities. Well, maybe part of it is the commentary is on the pressing need for addressing faith leaders and talking about trans visibility and these other issues because of the political attacks on trans groups. So talking about that as an argument, leading to conclusions, and then it should be grounded in literature. So that literature articles that are published in peer-reviewed journals. The good news is that there are a lot of articles that are open access, like what Megan mentioned. So you could find articles online through Google. The best place I would say is go to Google Scholar, and it pulls up articles that you can access. So these are 1,000 to 4,000 words. They're much shorter. And yes, next slide.
Could I just jump in for 1
Sure.
second? I thought of the sample abstract that we have up for a commentary is a nice one. So I just advise people to look at that. But the point about having literature to include, that abstract uses a kind of a paradigm of structural racism, and then brings in empirical facts about oral health disparities. The person who wrote it is a professor at a dental school, and then goes sort of scopes back out again and talks about those facts in terms of structural racism. The part about the oral health facts, they had to cite, where they got this information about disparities existing in the case of oral health. So it's important when you make statements of fact that you ground it in the literature. But I don't want to overstate how much literature you need to involve. Just when you state facts, you have to cite sources.
Yeah. So I think that kind of emphasizes what's on this slide about it being clear, strong statement of the issue, be engaging, continue by dividing into the argument you will make in the paper, present the outline of the argument, any support or controversy in the literature, and the conclusion. And if you have any factual information, make sure that you cite a reference to support that fact, usually from a peer-reviewed journal.
I have a question.
Yes.
Will citations count towards the word limit in the abstract?
No.
Okay, thank you.
So usually in abstracts, you don't include the citation. That's usually in the article where you include the citation. So you wouldn't necessarily put in parentheses the article, the citation in the abstract, only in the actual full manuscript. Okay, heroes and great ideas column. This is a space for telling stories of people. This is where we're actually thinking most of you all will probably submit these types of articles. It's a space for telling stories of people and initiatives that have worked successfully to improve life in medically underserved communities. They can include traditional biographical or historical accounts, essays, and narratives. So the word limit for this article is 2,000 words, which Virginia said was about 10 pages, double spaced. So I guess the good thing is that it gives you room to write without feeling constrained. Like the commentary is a really short article, but the 2,000 words gives you a little bit more room. Procedures for cover letter, tables, figures, permissions, submission, copyright, proofs, and reprint. I think that's, I don't think we need to cover that per se. I think that last bullet is really for when you're submitting your full manuscript.
That I just need to jump in again, sorry.
Please, go ahead.
I wanted to say that the Heroes and Great Ideas column, especially if we get a lot of them, they will go out for external review, not just review by the editorial staff. So I just wanted to clarify that.
Thank you. All right, next slide. So now getting even more into the weeds. The title is summarize the work as well as possible, and it catches the reviewer's attention. So if you go to the next slide, I have an example of a title. This one is okay. I wouldn't say it catches the reviewer's attention, but I think it does cover what the topic is: centering community expertise in designing for digital health equity. If Kia, if you could go back to one of my examples of like my cover letter, or yeah, okay. So this one, when I came up with the title for my paper, I actually pulled a quote from one of our interviews and used it as a part of the title because I felt like it really reflected the overarching theme of the paper. And I actually hear people say this over and over again anytime we're talking about HIV community engagement, meet people where they are. So that's what we started out with. That's the catchy part of the title. And then you go into a qualitative study of, so that for us, because it's a research paper, I included the type of research that we did. So we did qualitative research, which means interviews and focus groups or observations. And then what did we study? We studied community barriers and facilitators to HIV testing and self-testing among who? African Americans, where? In urban and rural areas in North Carolina. So that's kind of there is a formula for creating titles. And I think that same formula communicates the information in your abstract. Next, can you go back to thank you. Okay, so the background section, 2 to 3 brief sentences that talks about the problem. What is the problem in that you're trying to address with the work? Maybe even, so I'm curious, Virginia, in the heroes, would we need to include a background for that as well?
The heroes and great ideas columns are so kind of approachable. You write it almost as if you were writing for a magazine or something like that. I think it has a very different feel to it.
Okay, so but this is more for like a reports from the field type article. If you're going to write one like that, you want to have a background, like what's the problem in faith leaders traditionally have not addressed HIV in their faith communities, and there's very little bit of information about their perspectives on how to engage this work. You know, so that's, you can start off with that. That's the background. Why is the topic being investigated in this paper important? Is this, you know, we in this paper we explore or examine. In this paper we examine the effectiveness of trainings with faith leaders in Atlanta, Georgia, addressing HIV stigma. What previous work has been done in this area? I think you can say like previous work has been done in Alabama, but little research has been done in the Atlanta area to see the applicability. So that answers both questions, that has been done here, but it hasn't. This is how we're adding something new. We're doing it new in Atlanta. What are the research questions? So that's if it's a research paper, but these aren't research papers, that the reports from the field. So it'd be like more of a, we report on the work that we did with our intervention of faith leaders in Atlanta. Next slide. So this is an example of a background section from an abstract. And this actually, we pulled from one of the sample abstracts that Virginia supplied. And this one was published in Journal for the Healthcare Poor and Underserved. So you can see this is the problem. Clinical program design, implementation, evaluation are often done without meaningful input from communities most impacted by systematic oppression and health inequities. For example, Black, BIPOC. COVID-19 further exacerbates inequities created by unjust structures. So that's the problem. Then new healthcare systems should be co-designed with communities most harmed by these structures. So that's kind of the new contribution, or like, what's the gap? In recognition of the need to minimize the harmful impacts of our power differentials, we began by surfacing professional healthcare program norms that perpetuate health. So this is what they did. This was their program project. they did that thing. And then so they articulated what their strategies were for addressing that gap. And then our work is grounded in anti-oppression values, redistributing power, developing authentic relationships, and mutual accountability. So that's the new contribution. Next slide. Okay, so then the next section of this abstract for reports from the field is the full description of the project. So this portion of the abstract describes the approach you would take to design and implement your project. It connects to the discussion in the background section and how your project is addressing the gaps in that section, what data, if any, you have to inform the design of the project, how and when was the project implemented, who was reached, and how many were impacted by your project, how were they impacted? So all of these things are things that you would include in the project section. And if you have descriptive data, like more just like, this is how we did it, and getting some quotes, make sure there's a gap in the existing literature that your new data fills. Make sure you have said how your paper is accomplishing something new.
Could I jump
that,
in?
Yeah, go ahead.
I wanted to say that in saying, well, we're establishing this as something new, it's a little bit more intuitive in the case of reports from the field. So let me give you an example, just from the point of view of an editor. Today, I'll say this because it's all very anonymous. I received a paper that was submitted as a report from the field, and it concerned an initiative by this group in Canada to give people money as an intervention, a structural intervention. And it's a report from the field. And I thought, damn, that's interesting that they would do that, that they would go so far and empower people with actual dollars. So I took that in and I'm sending it out for reviews. In contrast with that, it's very common for medical students to write papers about free clinics that they're involved with and send them to us. We get, I tell you, I can't tell you the number that I've gotten. I think med students are very motivated people because they all write these papers. So they typically don't stand out enough to even get considered because they're just, it's too common. You know, why publish another one? You know, they're all nice, they're good interventions, but they're all pretty much the same thing. So establishing that it's new is a kind of an intuitive thing. Is it new? What's new? What do you feel excited about your project? And you do want to scope around and see if there's things just like it, but more than likely you know what's importantly special about your work. That's it.
I just want to check in on the time. Are we good on time, or are we kind of, because I see people are dropping off?
We're at about an hour.
Okay, so we technically have 30 minutes.
Mhm.
Okay, great. Next slide. All right. So this is the sample project description section. The co-led program will center on communities exposed to systematic harm to co-design digital health with the intersection of technology and healthcare. They had 3 goals. So you outline the goals of the project, and then they connected with, well, this one is something that would be done in the future. They will with 8 CBO liaisons who will be partners for how digital health would improve their health and well-being. And then they use human-centered design as a process framework. So I think if you could articulate that, like what's the framework you're using, what's the theory, but I don't know if that's necessary per se for the articles that you all submit. the evaluation section of the abstract will briefly tell how you evaluate the project, like what surveys, what data you use, what were the outcomes, did you do interviews, focus groups, what were the outcomes? Or maybe if the work is not finished from analyzing the data, you are studying what will you collect to determine the success of the program.
And
And
even descriptive data, like we've communicated with this many people, or we had a health fair and had this many people attend, that's data.
yeah,
So include
or
that.
in
data.
social media analytics,
Yes,
or radio listens, people who called in and comments on your Facebook posts. I think all of that is data.
right.
Be specific and exactly what the analyzed data mean and how it demonstrates successful project implementation. All right, next slide. So this is an example of an evaluation section for the abstract. They will evaluate the impact of the program by describing group dynamics of the collaboration through interviews, meeting minutes, and surveys and electronic health record data. In-depth interviews will be conducted at the conclusion to get their understanding of beliefs about the experience felt to team members. And then they included some of the questions and like the themes that they're looking at: lens of collaboration, power, and impact. And then they pulled data from the EHR to assess changes and disparities. So you could say we pulled data from social media analytics over time to assess the increase in number of people that we've engaged over time, right? So that I think is a good example of ways that you can pull data.
Virginia, can I ask a quick question because it came up in the chat earlier? So the distinction between the kind of evaluation data and information that might be aligned with a report from the field, and how is that different from original research?
It's different because the report from the field is descriptive. It's just, it's strictly descriptive. You could say 75 people attended an event or something like that. And that's a number, but it's not an analysis. It's just a description. It's sort of, you could say that in a bunch of different ways. You could say, less than 100, but more than 50. You can say it in a bunch of different ways. So it's not very formal analytically, but you say that in a report from the field. What you don't say is things like, we conducted this statistical analysis with these numbers. So the original research is very different. It takes that descriptive information and does things with it. And then the report from the field, you're just describing what happened as carefully as you can. And sometimes that involves some numbers.
Thank you. All right, next slide. Okay, so I think we're finally out of the weeds a little bit. So we will be providing technical assistance, but we need you all to complete, if you have not already, complete a survey to tell us what type of technical assistance you need. We have some suggestions in the survey. Some ideas are to have office hours where funded partners could join us and talk through their ideas, or get some feedback on the abstracts, a rough draft of their abstract, maybe, or you could email us with some brief feedback that we could give you on your abstracts. We could, again, kind of clarify some of the, maybe help you decide which type of paper is the best fit for the ideas that you have and the type of data. So those are some of the technical assistance that we'll be providing. But also, please keep in mind that we are also submitting our own abstracts. So it can be a little overwhelming for us to be writing our own papers and be doing a lot of TA with you all as well. So we want to make sure that we are available for you all, but also be aware that we're doing the same thing y'all are doing. We're writing abstracts as well. And then the review process. So once you submit your abstracts to that email, there will be a committee from, I think one person from ETR, as well as who is not submitting an abstract. They're just going to be serving on the review committee, and as well as the editorial board from the journal will be reviewing the abstracts. They are not planning to give extensive feedback on the abstracts. They're going to review them, discuss them, select the ones that are the strongest, and send out invitations for those people or organizations to submit full manuscripts. Those full manuscripts are due, and so you'll get that email in mid-August, and then the full manuscript is due October 1st.
I just thought I'd mention the reviewing of the abstracts is completely blinded. So the reviewers don't know the identity of the authors of the abstract or what organization they're with. They're just anonymous.
Yes. So I think I have a question, and so Virginia, once they get an invitation to submit a full manuscript, where would they submit that full manuscript? Is it to the same email?
No, not at all. That's
Right, it would be through the portal.
thing.
Okay, so we are, once we send out the invitations for full manuscripts, we're going to have another webinar for all the people who were invited to submit full manuscripts, and we're going to go through some more detail about article writing, and then also the mechanism for submitting your manuscript through the journal's portal. They have basically a website portal that you can submit your manuscript to. Okay, so again, the review process, they'll review the abstracts using a detailed score sheet. It'll be blinded, so they don't know who wrote the article, and you will not know who reviewed your specific article. They will not be providing feedback, but it will just say, do not move forward or move forward. Next slide. And I think that's it. Any additional questions? All right, well, we look forward to supporting you all, and we're very excited about it. We hope that this does not intimidate you all, but hopefully gives you some some encouragement that we believe in you and that you can do this, and we're very happy to support you in this work. All right, and you see this stuff in the chat. You can find this recording and all the information on gileadcompass.com/call-for-abstracts. Call-for-abstracts. All right, everyone have a good afternoon. Bye.